News 8 is partnering with Griffin Health to help you lead a healthy lifestyle. I'm joined by Dr. Michael Kessler, who works in obstetrics and gynecology at Griffin Hospital. It's great to have you, Dr. Kessler.
Thank you.
When we talk about pregnancies, we're always talking about healthy moms, healthy babies. Isn't that what it's all about?
Correct. That's it. That it is.
But you also encourage other things going on.
So a lot of time when the women are coming in, it's very crucial for us to understand their concerns, their risks, and then really taking from a bar. I talk to all my patients. I say, listen, we need to drop your risk. We need to talk about healthy eating, healthy lifestyle, making some changes in their mood, making changes in their sleep, and I think all these things will benefit the women, for a much healthier pregnancy and as well.
You want to create an in-depth discussion.
Correct, of course. Again, when women are coming in, we need to, look at, their health concerns, their health risks, their history. And again, it's also important to actually take the information from their parents as well. I think we're getting a lot more information these days about women who their mothers had pregnancy complications, and that actually is important towards incorporating that into the risk profile that the woman has for the current pregnancy.
What questions should women be bringing when they meet with you?
So the questions would be, were they themselves delivered prematurely? Did their mother have preeclampsia? Did their mother have things like endometriosis? So these are things that we can incorporate into the current, pregnancy care and management that'll actually help us to make some changes and look for risk for the patient.
What don't women ask you about?
A lot of things, actually, and I think one of the more important things is actually asking about a sexual history and a sexual health, because I think that has ramifications as well.
But that's a subject that a lot of women don't want to talk about.
Correct, but I think it's important to establish a relationship between yourself and the patient and make them feel comfortable, such that you can not only joke about it a little bit, but then you're gleaning information a little bit a little bit at a time. And I think that once you start to get that degree of rapport, I think then the information, correct, and then it's coming back between yourself, and that's great to get that information and then help them to make some better choices.
A lot of women also don't realize that an OBGYN is actually a primary care physician.
Correct. We do manage things like hypertension, we'll manage thyroid disease, some mental health issues. Obviously if we have concerns, we refer them out, but for the most part, we can manage these things.
You just told me something about how heart health actually impacts women. Can you explain a little bit more?
Right. So in pregnancy, actually, it's interesting that some things like gestational diabetes, which unfortunately is becoming more prevalent, and as well as preeclampsia, which is prevalent as well, and can lead to adverse birth outcomes, it is associated with a future risk of cardiovascular disease. So at least with my patients, I'm informing them of, the benefits to staying healthy in pregnancy to avoid these pregnancy complications. And if you do have them, again, it's going to be lifestyle modification and yearly assessment to make sure that they don't develop future things like heart disease or stroke.
So visits to the OBGYN could actually be a little longer than usual now?
They may be, but the good part is that, we don't need to do breast exams as often. We don't need to do Pap tests as often. We don't need to do pelvic exams as often. So in the time that, my parent organization called ACOG says we don't need to do these things, and the good part for me is that I use a lot more time for education.
Excellent. Dr. Kessler, thank you so much.
Thank you very much for having me.
And for more information, you can go to griffinhealth.org.